What up everybody, welcome back to my channel. I'm Jimmy and today I got a very special video for you today. Today I'm going to go over on what you can expect from your 4th week post-op ACL surgery. So how is my recovery going so far? So far my pain is pretty mild. I'm still working on getting my leg to go completely straight when I'm walking because I'm still having issues with that. I'm still not able to move around like I normally do. And some days are better than others. Like some days I can have some nice sharp pain in the morning and other days are pretty smooth. I have a quick tip though for anyone that's trying to get their legs straight and they're going through this process. Always when you're walking, try to think in your brain to go heel to toe when you're walking. Because when I'm walking, and I didn't really notice this until someone pointed out to me that I wasn't going heel to toe. I was actually just going on my toes and just not bending my leg or bending my knee as I should have been. And I feel like if I would have done that and really emphasized walking heel to toe and starting to really get my legs straight as I possibly can when I am going heel to toe. So that's just a quick tip for anyone that needs to get their legs straight. Maybe you're not doing that, maybe you are, or maybe you didn't even think about it. That is for you. If you were to ask me what percent I am from being 100% healthy and 0 being I cannot walk, I'd say I'm about 50% because I cannot jog, I cannot run, being towards 100% and being normal, and I can walk and I'm getting normal again. So I'm about 50% at the moment. I cannot jog right now. I can jog, but sometimes if I step wrong it does hurt. So if I were to jog, I just wouldn't trust myself. I wouldn't want to re-injure myself, and my doctor says do not even run until 6 months. So I'm really going to stand by that and not do that. Now for my nice wonderful complication that I ran into on week 4. So on my leg, on the bottom of my incision on my knee, I had a nice redness mark, and it looked like it was healing. There was no scabbing. It was just like a red circle. And it did feel weird, but I couldn't really differentiate from the pain that I was having, just my pain I normally have, or if it was something else and it was just an awkward feeling. So I ended up being a wise guy, a smart, and I pressed on it, and I barely pressed on it, and it poof, and it popped, and a lot of green, yellow pus came out. So I was a little worried. I didn't think it was infected like that, but come to think of it, I should have thought that. So the day after I popped it the first time, the second time I pressed on it again, and I got some more stuff out of it, and I cleaned it with peroxide again, and put a fresh Band-Aid on it. And I didn't think about calling the doctors yet because maybe I just thought it would heal on its own. So on the second day I pressed on it again and more pus came out. So I decided, my wife really nudged me to go to the doctors and just have them check it out at least. They did say that it's most likely a stitch because on the ends of your stitches, on the ends of your incision, they put a couple knots on it so your stitches don't unravel. And these are dissolvable stitches, but there tends to be a lot of knots on them and they don't dissolve, or it takes longer and your body is trying to reject it. So the doctor sends the nurse in. 2 to 3 minutes go by. She's fishing, literally fishing in my wound with some tweezers and some scissors, and it hurts. She's in there poking the flesh, and it doesn't feel good. Anyways, she said she couldn't find anything. She just pulled a little something out, she said, but she went in again, and she actually found it this time after another few minutes of fishing in my wound. She clipped it, and it felt like if you were to pull a hair out of there, but it was a good size. I wish I could have took a picture for you guys so I can just show you, but the stitch, it was like a good 4 to 5 knots. And yeah, if I seen it, that thing was not dissolving. That thing was thick. It looked so normal, like it didn't even try to dissolve yet. Anyways, she took it out. She cleaned me up, bandaged me up, and it was good to go. She said I didn't get antibiotics or anything, so far so good. Last and final thing, where I'm at in physical therapy right now. So in physical therapy, I'm just doing a lot of biking still for about 15 minutes on a level 1. I'm doing a lot of hamstring stretches, a lot of calf stretches. I am doing squats. Squats are a little difficult because when you go down, and you start to bend your knee at this point when you're going to your butt to the ground, it does hurt. It does send a nice sharp pain. So I try not to go too low when I'm doing my squats, and also when I do come up from my squats, I'm trying to straighten my leg as straight as I can, but I got to really focus on doing so. But other than that, that's where I'm at in physical therapy. It's been pretty mild still, nothing too hard or difficult quite yet. Some advice for people that are going through this right now, I really suggest if you're in your brace and your ACE bandage and you just got out of surgery, you're about a week in or whatnot, really start moving your leg as much as you possibly can. For instance, your legs in your ACE bandage and your brace, just start pumping your calf muscle, start pumping your foot and pump your calf muscle to get it active. Also, I know you're lifting your leg up, like you're picking your whole leg up and throwing it on the bed or throwing it on the couch because it hurts so bad to lift it. But when you're on the bed, just try to lift it like an inch. Just lift your leg up, just a little bit, and really just try to keep your thigh muscle moving as well. I know it's gonna hurt, it's painful, it's brutal, but just try to move it a little bit. It will help you so much in the end. I wish I would have done more to do that, to prepare myself for getting better. Also, treat your injured leg as equal to your good leg. What I mean by that is try not to baby it as much, because if you're just gonna baby your bad leg, it's never gonna be able to be the same as your good leg because you're always babying it all the time. Take it as you got a 30-year-old son living with you. You keep babying him, he's never gonna leave and get out and grow up, right? Same concept. So try not to baby it as much so it can just heal a little bit faster. I mean, you can be back to normal quicker. That is all for me. Thank you so much for tuning into my video. If you liked the video, please smash that thumbs up button. And also, if you'd like to see more videos from me, please press that subscribe button wherever it is. And as always, thank you so much for watching my video till the end. Have a good night. Peace.